law was adopted, but nobody's actually doing it. And Dr. Murillo from Bogota will be talking about that point.
May I have a comment it is for Dr. Tania Soldak. It's just a comment for thinking, maybe. I saw from your presentation that there are many negative things in East Europe. Okay, it is good to show the negativity, if I understand well. But there are, I think, in East Europe also many positive things that could be used. And there are maybe things about culture, about emotional things, about personalities. And I think my very modest understanding of the word global is not just global is a world, but global to different aspects of everything. So using the culture, using the positive things, not necessarily to be a copy from other societies, and how to manipulate these things to be positively. Because from my very modest experience, I found there are many positive things in East Europe that are not used, because sometimes we would like to copy models as it is. Maybe I am pro-East Europe than you, I don't know. I'm royal more than the king, maybe.
Hello. Thank you for your question. And the topic of my presentation was advocacy as a tool for change. So I tried to stay in an assignment and basically demonstrate what advocacy actually is supposed to do, not demonstrate negativity or positivity. It's basically what we need to change. And what is common in Eastern Europe, it's post-socialistic states. And we're dealing with government. And I know that Americans understand here how difficult to deal with government, and if it is huge government. So we advocates, and it's not supposed to be like a negative or positive. It's just what we have. It's fact. And if you think that women dealing with the huge governmental system machine, and basically doctors are all governmental employees, you can imagine assignment how difficult to make changes. That's why I presented the strategy that we analyze basically not only in breast cancer, but in HIV and child survivorship and maternity, reproductive health, that would use, and basically, because we're working not only in breast cancer, we're working in infection diseases. And that's why this part of the world, it's famous for. It's a strong government and post-socialism, and many things can be achieved, but if you're dealing with government, it's really difficult. The biggest challenge for us. Thank you for your question.
I think we have 2 more questions from over there. Yes, the gentleman. Yes. And one question from here. Yes, you've got the mic already. Would you like to ask the question? Yes. Oh. There first. Yes.
Dr. Manuel Gomez from Mexico. Dr. Christine, great lecture. Thank you. And just to notice a couple of things. Regarding your work at the institution, this social service institution is just for the working people and their families. And the problem, I think, it's regards to the people who doesn't have this coverage of health. The guys or the girls who doesn't have this insurance, this treatment chance, or this diagnosis, and they have to pay for the treatment. Otherwise, there are people who has this insurance, this coverage, but due to the waiting times, they have to do surgery outside the institution and then come back to the institution to receive chemotherapy, trastuzumab, etc. But this is not a problem of mine, because the IMSS has great doctors. The protocols are doing really good. The problem is that we don't have a lot of space for treating people. And the real problem is that everything is so centralized, as we saw in the Uruguay lecture. All in the capital, we have radiotherapy. In the capital, we have medical oncologists. And in the rest of the country, well, at least I'm from Guadalajara, which is the second biggest city in Mexico, and we do have radiotherapy, we have nuclear medicine. At the Social Security, we have magnetic resonance imaging. But in the rest of the country, we are a 100 million people country. So it's a really big problem regarding the amount of people that can afford treatment, that can afford diagnosis. We have people already in the 21st century that can't read, can't speak well. So, I mean, the problem is not in Mexico City, not in Guadalajara. We have to create programs in Mexico City, in Guadalajara, in Monterrey, which are the biggest city, and then start growing around to I don't know, collect all the people from different parts of the country. But however, thank you for your interest in Mexico. I think it's a great job. Thank you.
Thank you. Yes, another? Yes.
Dr. Uribe from Venezuela. I would like to congratulate doctors from Chile and Uruguay. This is a very good example of collaboration between the doctors, the physician, and the government. In our country, in Venezuela, we really have a big problem. The breast cancer is a very important disease. We have a very good prepared doctors also. There are all over the country people who knows about medical oncology, radiation therapy, all the things that should be done in order to diagnose and treat the cancer. But we have no the support from the government. We don't expect to have the support from the government of Venezuela in order to improve the problem that represent breast cancer. But we, as medical society dedicated to breast cancer treatment, we have to do something. That's why we are here. Last March, we talked with Dr. Anderson in Miami, and he mentioned to me that it was a good idea to come here and see what happened with the people for our countries. And I saw that it was a good idea to come here, see how we could find ways to help the people that has breast cancer. In Venezuela, 80% of the people have advanced breast cancer. They go to the public hospital and they cannot find good service, good mammography. The people, the doctors, they are leaving the hospital, they are not well paying. They don't receive payment for the tours. So we have to do something. This is why we are here. And I expect to talk with doctors here, find ideas, find ways in order to do something for the people that has advanced breast cancer in Venezuela.